Cholera is a disease caused by bacteria. It can be transmitted through contaminated food or water, resulting to acute diarrhea, with children being the main victims. Now, dirty environment and poor hygiene make the disease predominant in Africa, and Nigeria isn't spared at all. The United Nations says about 100 people lost their lives to cholera within 2 weeks in northeastern Nigeria in September this year alone, with more than 3,000 cholera cases recorded in Yobe and Borno states. Well, many insist that the resurgence of cholera in alarming dimensions in the country calls for great concern and action. What are the intervention measures, and to what extent are they helping to curtail the spread of this disease? What should the people as well as the government do to prevent and finally eliminate cholera in Nigeria? That's our focus on Nigeria today. I am Anne Jibuno. Thanks for joining us. With me in the studio to discuss cholera outbreak containment, the journey so far, is Dr. Kobi Ampa. He is a consultant on cholera at the World Health Organization. Thanks for joining us. Thank you. And we also have with us Dr. Abiodun Oguniyi. He is with the Nigeria Center for Disease Control, NCDC. He's also a consultant epidemiologist. Thanks for joining us.
Thank you. Maybe for courtesy you use the doctor, but I don't go with the title. Thank you.
Well, and you're also a member of the technical working group on cholera response in Nigeria.
You're very correct.
Well, I will start with you, Dr. Oguniyi. How dangerous is cholera, and what is the main, or rather what are the main symptoms?
Yeah, thank you. Cholera, it's a disease caused by a bacterium, a group called Vibrio cholera, and it affects the small intestine. And when this happens, the infected persons could produce different symptoms. Some could go with no symptoms at all. Maybe they have enough immunity to withstand it. Other symptoms could be mild. Others could be very severe. And this starts from diarrhea, that is acute watery diarrhea, and that is passing of very loose watery stool. That's a typical coloration that will colorize water stool, and this diarrhea continues profusely for hours. Then it follows also by vomiting. There could be muscle cramps, and the series of events following that, which leads to severe dehydration, could lead the affected persons into shock. If left unattended to, cholera could get really severe and could claim lives within hours. And so within the period in which the person is exposed to the organism, which is within, like, some could start coming down with the symptoms within 2 hours, while others could be as much as up to 5 days. But all these symptoms are going to follow some proceedings before the patients get complicated. Others will recover from heat and they're fine.
Okay, now, Dr. Ampa, you are of the WHO, that's the World Health Organization. What is the state of cholera in Nigeria today from your findings?
So, in terms of figures, Nigeria, cholera was first notified in Nigeria in December 1972, and from there to about 1990, there were low incidence of cholera. But from 1990 to this year, we've been seeing spikes in cases, and I can tell you for 6 years during this period, including this year, Nigeria has recorded more than 20,000 cases per year. And during these very periods, it represented, for each year, it represented about 10% of the global burden. And as we speak, 2018 alone, as of last week, Nigeria had recorded more than 48,000 cases with over 800 deaths.
Now, these are alarming figures, Dr. Oguniyi. I know you said I shouldn't call you doctor, but pardon me for that. Now, in 2017, we noticed that with the support of the WHO and other partners, Nigeria was able to curtail this disease to an extent. What happened?
Cholera is a disease of inequity. Suffice to say that as far as the prevailing conditions to drive the infection is still very much around us, we most likely will keep having cases. However, let me put on record that when we see spikes in the number of cases, it may not necessarily be that we have more cases than before. Most times it's because now, especially in recent time, it's because we have heightened our surveillance activities as far as Nigeria Center for Disease Control is concerned, which has helped us to be able to detect more cases, because initially when cases occur and nobody detects it, then you think they are not there. But now we have structures in place to quickly ensure that they are detected, and with the detection, then it seems as if the numbers are high. Now, I get a little uncomfortable with figures when they become so alarming. I wish we, as much as possible, think of what we are doing or what we need to do as government, as individuals, to help stem the tide, which is, I think, one of the things we'll be discussing on the program today. Still
staying with you, is it for children? Is cholera a children's disease, or adults are also prone to cholera?
Now, it's a disease that can affect any age. Now, why it's more prevalent in children is because of possibly their immune status. So, but from what we have seen so far, cases of death are more common among children, of course, because maybe when they're not able to quickly report in the health facilities, and it is a disease that is more common in developing countries or underdeveloped countries. You hardly hear of cholera in developed countries, even though they have children too. So there are other factors of that, like it was put somewhere that the distribution of cholera in the world, and you put it on the world map, has a similar map pattern with poverty distribution. And so this is closely related to poverty, because there are diseases that have to do with not having safe drinking water, having food contaminated with fecal transmission, fecal contamination from humans who have the bacteria passed from their stool. And so these are things that you find in areas where there's issues with water, with sanitation, with hygiene, where people engage in open defecation. And as soon as this is happening, children are most likely going to be the one playing around, have contact with all those environmental factors that could easily get them in. They're the ones that will not likely wash their hands when they pick food substance to eat. A more matured person will think of even washing his hand before eating, for instance. So that's why it seems like children are more affected, in addition to other factors that are present within the population.
Now, Dr. Wampa, which states are prone to cholera and why in Nigeria?
Oh, if nationwide, we'll say virtually all states are at risk. I mean, at each point in time, certain states have reported more than others. So for this particular outbreak, it's mainly the northern states, especially the northeast. And, you know, some of the vulnerability factors, such as the insecurity, the humanitarian situation there, and then also wash. The prevalent driving factor, like Dr. Biodo mentioned, is a wash. That's the supply of safe water, and then also the practice of good hygiene.
All right, Dr. Oguni, could you add to what he's saying? Based on your work across the country, which particular states have you noticed?
With respect to our focus on the Global Task Force for Control of the strategy put in place by the Global Task Force for Control of Cholera, it's encouraged that we identify and map the hot spots for cholera. And this is talking about part of the country where cholera is happening at every season. Some even out of season, they keep recording it. It's like a common trend over the years. And these have some of the states he has mentioned. We have some other states in the country, like in Oyo State, even in FCT, we've had cases. We've had pockets of cases here and there, but where it's more prevalent has to do with where we have challenges with overcrowding, for instance, when people, the living conditions are so congested. In those areas, you definitely, with high population density, you're possibly going to have more cases among them when such crises occur. And so that has been the trend in recent time.
Now, you want to say something?
Yeah, to add to what he said concerning the hotspots. So these areas, normally they are geographically restricted areas, and they are responsible most of the time for also the spread of the disease. And like he said, the Global Task Force approach is, if we could target these areas, these limited areas with our interventions, with providing them with good water and also the early case detection, we can make big strides. And if we, from the hotspot exercise that he mentioned, that we carried out, we were able to identify, 105 local government areas in 16 states. that are recording, or these are areas which are hotspots in Nigeria. So then our next step is then, how do we target these areas with our interventions?
All right, how do we target those areas? We will be getting to those issues, but we will be taking a break now. When we return, we'll take a look at the interventions by the WHO to curb cholera in Nigeria.
The Nigerian Television Authority News 24 channel, your dependable all-round news station, offering you world-class news programs, documentaries, spotlights, promos and information highlights. Take advantage of our network reach and advertise your interest, goods and services with us. NTA News 24, first among equals with digital broadcasting. You can reach us on channel 21 terrestrial TV and channel 101 on the Star Times platform. For more inquiries, please call Henry on 0803 379 0884. Join us today.
Thanks for joining us. We are taking a look at cholera and its containment in Nigeria. Dr. Ampa, before we went on break, you were trying to delve into the interventions by the WHO in this area. Now, let's take a look at some of your interventions. I'm aware that there is something on vaccination, oral vaccination, for instance, and some other interventions. Could you tell us?
Yeah, so oral cholera vaccines, these are very effective too, but it has, limited protectiveness. It protects for up to 3 years. And like he mentioned, the developed countries got rid of cholera without the vaccines, because the vaccines are the new tools that we have, relatively new tools that we have. So the main intervention really is WASH. And the government has plans in place for improving water by 2030, but we all know this take time, as well as also behavioral change. This, we all know, it takes time for people to change their behavior. So what we do now is to use the vaccine as a tool, if I may say, to buy time, so that we can improve on the WASH infrastructure, the water infrastructure, and then the behavioral change.
I can see you nodding. You want to add to that?
Yeah, so going by the Global Task Force strategy, there are 3 main strategies that we are also adopting as a country. One has to do with early detection and response. And to ensure that there is early detection of the cases, there is a need to strengthen the laboratories and the health systems in all our facilities. 2, it's a multi-sectoral approach to whatever we are doing. Multi-sectoral approach made us understand the fact that for cholera, it's a discussion that goes with the Ministry of Environment, that goes with the Ministry of Water Resources and Ministry of Health and other related agencies and parastatals of government that ask factors that contribute to what we're really discussing. And so the interventions of governments ensure that all these sectors are coordinated to mobilize resources, to mobilize technical expertise, and through a coordination mechanism, which is a third strategy, they ensure that all these factors, all these components are well integrated to address the needs at the state level. And for us at the Nigeria Center for Disease Control, for instance, our role is to strengthen and support the states, because this has to be domesticated. The interventions are occurring at the state level. For all you care, most of the cases come from some rural areas, some areas with some of these infrastructure that are not present. And so our responsibility is to see how we support the state, because the state needs to take the ownership of some of these response activities, if not all. And we provide the necessary technical expertise. We pull the resources together to mobilize resources to support them. And this has really been working. For instance, in the area of vaccination, like Dr. Aparheria mentioned, out of the 105 hotspots, local government areas that are on the hotspot list for now, at least the first batch of vaccination exercise is ongoing, which will end tomorrow, and that is targeting 5 of the health GAs. And you will ask, 5 out of 105? How do we really get out of this? But it's the OCV, the oral cholera vaccine, is just a new intervention that has just been piloted not too long ago, and with its limitations. So it's also not in good supply for now, but as we are receiving it, there are also plans to scale it up to all the other 95 going to 100 local government areas. So the first 5 is going on. The next 5, maybe like in January, we're going to get them vaccinated as we get the supplies. And the beauty of it is that or should I really say it's a beauty? The concern with that vaccination process, just like you said, is that it is just for 3 years. So we are hoping that with the advancement in technology and research, we'll be able to have vaccines like yellow fever vaccine that is able to confer a longer duration of protection for the people. But beyond the vaccination, the point is there are things that the community members need to do. The basic things to prevent ourselves, because these deaths are preventable, the disease itself is preventable.
You mentioned community. Now, how are you able to penetrate some of these areas, especially the areas where you have insurgency, for instance? How has it been for you, especially with regards to vaccination? What kind of feedback have you been getting?
Definitely, with insurgency in place, it is a difficult one. Of course, we have our tradies in providing response in during the humanitarian crisis. So we do our best as much as possible to work with the military personnel to assess those areas, most times working in partnership with WHO. You see us moving as if we are going to battlefront. You see military convoy in the front, military convoy at the back, because you have to ward off the likelihood of such attacks and all that. It's a very risky endeavors, which we have to put our life on the line just to ensure that Nigerians are safe. And that is why when you have insurgency or you have any form of humanitarian crisis, it's never a good moment. You see the situation happening with Ebola in DRC Congo. When there is crisis, it worsens response, and it makes it difficult even for health workers to assess those places and provide care for them. But it's not been all bad news. Of course, we've recorded progress because these people are in high DPs, and so it's easier to assess them at the internally displaced camps and provide these services for them. And so we've been able to record some success in this, but it will not be as the same as when you have areas like FCT, yes, where things are safer and it's easier to do our work here. Coupled with the fact that we've also had challenges with those who are hell-bent in causing confusion in the public, those who will generate wrong messages and tell you vaccine is not safe, or government is using vaccine to cause one thing or the other, a lot of propaganda that are not really helpful to the community. We've had to also battle this to ensure that, tell the Nigerian public that vaccines provided by the government, they are safe, they are free, and they are for the good of everybody. Now,
Dr. Ampa, what's WHO's experience with regards to feedback, penetration in all these areas where you have insurgency?
So WHO has also been assisting the government together with other partners like MSF, and sometimes they adapt local strategies. We never work in isolation, and just like he said, we sometimes have the military assistance, and they have the hit and run, so to speak, approach where we quickly vaccinate the population and then pull out of the community.
I'll still stay with you, Dr. Ampa. Now, tell us about your community house campaign. I'm aware you have something like that.
Okay. Yeah, so it's mainly for sensitization of the community, and as we go along with the vaccination, giving the vaccine, like I said, it's not good to have it in isolation. It's good to have it integrated with other strategies.
It's for vaccination.
It's for the vaccination campaign, yeah.
All right.
To accompany this intervention, the vaccine.
And the emergency operation centers?
Yes. So the emergency operation centers, like what the NCDC does, is to coordinate the actions of the various partners, and then, you know, to have it synergized, and also to identify where gaps are, and call on either partners or funding if it's also funding to get this.
And if I may add to that, at the grassroots level, the community engagement ensures that the community leaders, the community influencers, the social mobilizers, the health educators at the local government level are well engaged. And at the NCDC, through the support of our partners, MPHCD and host of them, we've also been able to, with UNICEF and others, we've been able to train our local government health educators, our state health educators, to get the right messages to the people and ensure that there is community ownership, because until the members of the community see this as our problem, until they see that these are things that we can really prevent by just keeping our environment safe. If you have to chlorinate your water before you drink it to make it safe, if you have to avoid food that are unsafe, for instance, those messages are really communicated to them at the grassroots, and they ensure that they take ownership of it to ensure that we prevent the cases.
Now, Dr. Ampa, there are so many agencies, especially in Nigeria's northeast. I know that's where the WHO is concentrating efforts, you know, towards combating cholera in Nigeria.
Yes.
How do you? Who takes the lead? How do you make quick decisions when there are so many agencies involved?
So it's coordinated. Like, I can't stress that enough. With the government takes the lead, and with then the partners supports. So we have MSF, like we know, that's Doctors Without Borders. They are able to. The MSF has an advantage of being able to move into situation and then respond as quickly as possible because they have direct, funding, and then also they have the expertise. And we also have, so many agencies. If I should start mentioning, we might leave some out and get into trouble. It's just so many of them.
Yeah, okay, exactly. Now, Dr. Oguni, will it be too much for Nigerians to ask for a state of emergency in cholera?
Okay, so I think you picked that from me because I was meant to pick on that. Just of recent, a couple of weeks ago, one of the good news is that the president, when we were launching the National Action Plan for WASH in Nigeria, the Water, Sanitation and Hygiene National Action Plan, during the launch of this action plan, the president of the country declared a state of emergency on that sector. And with this, it suggests to us, it gives a ray of hope that resources will be prioritized in this particular sector, and we want to see how this helps us, because we have a policy document now being developed and perfected to ensure that we are able to implement all our action plans in line with what the Global Task Force strategy plan is, because our focus on our target is to see that by the year 2030, for instance, at least as a country, we have 80% reduction in the burden of cholera in Nigeria. And with this strategic government push to declare state of emergency in that sector, because it's a major sector that could help us eliminate cholera in Nigeria, with this we have a ray of hope that things are going to get better with the community engagement, with support of all stakeholders, private sector, and all individuals involved in agencies of government and partners. We have a ray of hope that this is achievable.
Now, you mentioned the 2030 roadmap. Now, the WHO is planning to support Nigeria, I believe, and I'd like to know how you will rate your prevention so far.
Yeah, so for now we've developed the plan. We have a draft of it, and we are hoping to finalize. Of course, with the NCDC leading, we've assisted in developing the plan. And one is the vaccination. So with the hotspots that we identified, we were able to rank them in terms of priority. So we vaccinate from now in phases to 2023, and accompanying each vaccination campaign will be this preventive intervention. So the vaccination is also supposed to be the preventive manner. So when it's a time for an LGA, so to speak, even if there's no cholera, we would have to go ahead with the vaccination. Then that LGA is protected for the next 3 years, and then the WASH component can come in. We can also reinforce surveillance to see if there are any new cases. They can be taken quickly and then dealt with.
Very, very quickly, we are out of time. What's the long-term plan for cholera in Nigeria?
It has to do with all persons involved playing their role. And when I say all persons involved, as a government agency being committed to implementing the global action plan through the strategies I determined, as individuals, as citizens, the basic preventive messages are still valid. Infection control has to do with when you visit the toilet or you use the toilet, you wash your hand, because you never can tell when you contact some of these infections. When you clean your environment, you keep the dust, the waste away from you, and you avoid open defecation. That is, you know what open defecation is?
Of course we do.
Because some of these things that predisposes our people to infection.
All right, and Dr. Alpa, a very quick one, please. The final, your plan for cholera. Future plan.
So our future plan is basically also in line with the Global Task Force roadmap. Like I said, what we've drafted so far for now is the medium term. So in 5 years, we hope that we can, the first axis, early case detection and then response in order to contain the outbreak. And then the second axis, these hotspot areas, we'll vaccinate them. And then on the third axis, we'll be able to coordinate our efforts, even locally and also globally.
All right. Thank you very much, Dr. Kobe Ampa of the WHO, that's the World Health Organization, for joining us today. Dr. Ampa is also a consultant on cholera.
Yes, ma'am.
And I also must thank you, Dr. Abiodun Oguniyi. I know you said I shouldn't call you a doctor, but I will. It's from the Nigeria Center for Disease Control.
Thank you so much for having me on this night.
He's also a consultant epidemiologist.
Thank you so much.
And I must also say a very big thank you for keeping this date with us on Nigeria Today. On behalf of the crew, I am Anne Jibuno. Thanks for watching.